Hi, my name is Dr. Costopoulos. I'm one of the interventional cardiologists here at Royal Papworth Hospital, and I particularly, my main interest is treatment of valvular heart disease, which is the treatment of diseased heart valves. Tavi, which again stands for transcatheter aortic valve implantation, it is something that has developed over the last 15 to 20 years. Prior to the development of this treatment option, patients who were not physically well enough or they were too old to have aortic valve surgery, unfortunately not have any definitive treatment options for their condition. It is imperative that you visit your dentist if you haven't done so, because it is ideal that any dental work has been performed prior to having a new valve put in, irrespective of whether that is a Tavi valve or a surgical valve. How do we perform this procedure? In the majority of the cases, we do this from the femoral artery, which is one of the arteries in the groin. It is done under local anesthetic and increasingly with minimal sedation, so you will be awake during the procedure. You will be able to see to some extent what is happening. And what the procedure entails in more detail is after we gain access to the groin area, we put a sheath in that is probably the size of a 1p coin. Once the sheath is in, we go with a wire across the diseased valve, the aortic valve, and over that wire we implant the new valve. It sounds straightforward, it can be straightforward, but of course it's a big procedure, the equivalent of aortic valve surgery, and of course there are some risks and complications that come with it that we'll discuss in due course. Assuming all is well, we expect you to be, if you have your procedure in the morning, we expect you to be sitting up, having your dinner by evening, and in the majority of the cases, assuming all is well and in suitable patients, we're hoping for you to go home within the next 24 to 48 hours. You should be able to resume the majority of your daily activities, with the exception perhaps of driving, because we need to allow some time for the groin access site to heal, but you should be able to walk, shower yourself, cook and dress yourself, as well as look after yourself as you normally would. You should avoid heavy lifting in the first 4 weeks. So if us as physicians and as a team, we offer you the procedure, then be assured the reason why we offer it to you is because the risk of having the procedure is much less compared to the risk of not having it.
My name is Wendy and I'm a former patient at Royal Papworth. I went into hospital, I was very breathless. They gave me an asthma inhaler to take because I just couldn't get my breath. So I went in with breathlessness. I didn't realise it was heart failure. The operation took 2 hours. It was a valve. They were going to push across and up into my heart. You might feel this, he said, but I didn't feel anything. And after a little while he came and he said, "That's it, we're finished." And I said, "Is that 2 hours?" And he went, "Yes." When I came out into the ward, they checked my veins in my groin where the wounds were, and they said, "Goodness me, it's healed already." I'm feeling fine, yes. I have to keep telling myself to go slow. I would say go for it. It's amazing what he did putting in that valve. It's just given me new life. It's absolutely amazing. Oh yes, definitely go for it. I'm doing lots of things. I'm doing gardening and driving the car again. Yes, so it's amazing what they did. Absolute miracle, really was a miracle. And I would recommend anybody who was a bit not sure of having it done to have a Tavi done, yes. Your life will be changed forever.